there, we just thought it would be good to do a video to remind you of all the instructions that you had when you had your brace fitted, because on that day there's a lot to take in. So we thought if we did a little video of how to keep everything clean for us, it would be really handy for you to be able to watch. So here we go. So first of all, you've had your braces fitted. Obviously it's going to feel a little bit strange, might feel a little bit uncomfortable. You might notice for the first couple of days that your teeth feel a little bit tender or a little bit achy. If that happens and it's bugging you, you can just take what you would normally take for a headache. So you can take paracetamol, Nurofen, whatever you need. You might find that you get a few sore spots inside your lips, and that's because they're used to rubbing against a nice smooth tooth. Suddenly with a brace on, they've got something to rub against so they can get a bit sore and irritated. If that happens, there's some wax we recommend that you use. You just need to break off a small piece, that kind of size. You mould it with your fingers, roll it into a ball, make it a little bit more soft and pliable. And then you work out, you think, oh, it's a bit sore here. So you get your little bit of wax and you just push it and mould it over the bracket. Like that. It just forms a nice little cushion and stops the lip rubbing. If you use it as soon as you start feeling any sensitivity or soreness, it can prevent an ulcer forming. It will come off the next time you eat and drink. If you need to, you just replace it with another bit. When you have your braces fitted, the most important thing is to keep it all really clean and tidy, otherwise you can get some problems later on. You'll end up with marking and staining on your teeth when you have your braces taken off. Toothbrushing. We recommend either a manual toothbrush like this, which is double-ended, or an electric toothbrush. If you use the electric toothbrush, the only one we recommend is the Oral-B electric toothbrush, which comes with two different heads. They're specially designed for brace wearers. They won't pull out your wires. Normal heads can do that. When you're brushing your brace, it's really important to make sure that you don't only brush the teeth and the brace, that you also must brush the gums as well. So you want to be using small movements, making sure that you go all the way around all the surfaces of the teeth and the brace, making sure, really important, that you brush up to the gums as well. You go all the way around, and then you do the biting surfaces and the inside like you normally do. The little tufty end is really useful for getting into small spaces and gaps, or anywhere where you might have got a little bit of food caught. If you're using an electric toothbrush, you make sure that the toothbrush does the action. So you're just holding it against the tooth and angling it into the right positions, making sure again that you're brushing right up onto the gum and down onto all the surfaces of the teeth and around all the braces. If there's any areas where you think there's some food caught or food stuck, or plaque building up, you can use the little end of the toothbrush. It's perfectly designed to get in around your brace and it won't damage your brace at all. If you're using the electric toothbrush, you just swap the head over and use it in exactly the same way. Again, it's perfectly angled to just fit in underneath the wires and in difficult to clean areas. In the morning, that we recommend that you get up, eat your breakfast and then brush your teeth. That way you'll only have to be doing it once. Anytime that you're having anything to eat during the day, so if you're at school or college or work and you're having your lunch, it's a really good idea just to have a little travel toothbrush with you so you can give your teeth a quick brush after that. In the evenings, where we do the main cleaning, and there's a few extra bits to go through. So again, first of all, brush your tooth with whichever type of toothbrush you're using. We then recommend that you use disclosing tablets. They're these little purple tablets. You just need half a tablet. You pop it into your mouth, chew it up, push it all around your teeth, rinse out into the sink with water, keep rinsing until the water coming out of your mouth is almost clear, and then you need to have a good look. You pull your lips and cheeks back and you have a good look. Anywhere around your brace that's stained a purple or a pink colour means that there's some plaque that's been left behind. Then you need to go back in and brush that off. Again, using the little end of the toothbrush is brilliant for getting into those hard to reach places where you might have left some plaque behind. Once you've done that, we also recommend the use of TP brushes. A pink one and a blue one. Pink one's thinner, blue one's thicker. The pink ones are designed to replace flossing, so they're designed to go in between your teeth. You just gently put them in, give them a wiggle and pull them out. If they won't go through a space, don't force it, just move around to the next space and it will go through. The blue TP brushes are slightly thicker. They're designed to go underneath the wire and wiggle against the brackets. Again, it's just making sure that there's no plaque caught around the teeth and held around the brackets. These are reusable. You don't throw them away after the first use. You give them a rinse, pop the cap on, and then you can use them again. On average, you get about 10 days to 2 weeks with each brush. After you've done that, and there's a lot to do, last thing you need to do is have a rinse with this mouth rinse. You just need half a capful, give it a good swish around for 30 seconds, spit out any excess, and then go straight to bed. Nothing to eat or drink after that, then you're getting the maximum effect from the mouth rinse, helping to keep your enamel really strong. Hope that's been a handy reminder for you.